Preventing dehydration. Offer clear fluids including water, broths, popsicles, Jell-O. Have a variety of beverages available, as not everyone likes the same thing. Drink frequently during the daytime, rather than drinking large amounts at one time. Cool off indoors with a fan if person has been outside and temperature is high, and if appropriate, offer Pedialyte, Gatorade or Powerade, these contain electrolytes. Hydration is important for everyone. Hydration considerations include: the average person requires 64 ounces, 8 cups, of water daily. Some people cannot tolerate that much fluid and must have restrictions. Their medical doctor should be consulted regarding the recommended amount for them based on health concerns. Example, people with congestive heart failure and end-stage renal disease. Good hydration is important with or without a G-tube, especially if a person drinks thickened liquids. Some people may have difficulty swallowing, which can lead to a decrease in fluid intake, example Parkinson's disease, dementia, stroke, and if caring for someone who cannot communicate to ask for something to drink, remember to offer fluids frequently, every hour, to keep them hydrated. Constipation and bowel obstruction. Constipation is the slow movement of feces through the intestine which results in infrequent bowel movements and hard, dry stools. The longer it takes for stool to move through the large intestines, the more fluid is absorbed and the harder stool becomes, making it difficult and sometimes impossible to pass. Constipation signs and symptoms include, but are not limited to: changes in bowel habits. Infrequent bowel movements, less than 3 a week or more than 3 days between. Difficulty passing stools, straining, painful. Hard, dry, lumpy, small stools. Belly pain relieved by bowel movements, swollen abdomen. Bright red blood in stools and leaks of wet, diarrhea-like stool between regular bowel movements. Severe constipation can result in serious complications including rectal bleeding, nausea, vomiting, weight loss, bowel obstruction, fecal impaction, hemorrhoids, anal fissures and rectal prolapse. Two serious constipation issues are fecal impaction and bowel obstruction. Fecal impaction is when hard, dry stool is in the large intestines, often the rectum, and cannot be passed. Individuals with fecal impactions often have breathing difficulties due to the collection of the stool in the colon. Fecal impaction can be life-threatening. A bowel obstruction is either a partial or complete blockage of the small or large intestines and requires immediate medical attention. Bowel obstruction signs and symptoms include, but are not limited to: abdominal pain, swelling in fullness, vomiting, diarrhea, and odor to breath. Your role if symptoms are noted. You should immediately notify your supervisor and follow your agency's documentation rules if a person is constipated. A general rule to follow is that if there is no bowel movement in 2 days, report immediately to medical staff. If you suspect an individual has a bowel obstruction, call 911. Preventing constipation. Drink plenty of fluids, 64 ounces of water daily. Avoid caffeine, high-fat foods, and refined sugars. Eat a well-balanced fiber-rich diet with fruits, raisins, prunes, apples, vegetables, whole grains. Exercise regularly. Establish regular bowel habits including providing privacy for individual using the bathroom and schedule regular toileting especially after meals when the urge to defecate is normally the highest. People at risk for constipation include, but are not limited to, those who have diet changes, low fiber, high fat, high refined sugar, excessive caffeine, lack regular exercise and are inactive or immobile, do not have adequate fluid intake and hydration, are stressed, have a disruption of regular routine, travel, change in daily schedule, have medical and psychological conditions, Take medications, example, pain meds, anxiety or depression meds, diuretics, vitamins, sleep meds. Have poor bowel habits, holding back bowel movements. Use laxatives and/or enemas excessively and/or are older. Sepsis. Sepsis is a serious medical condition caused by an overwhelming immune response to infection. Sepsis can arise unpredictably and can progress rapidly. Sepsis springs from two factors: an infection, such as pneumonia or a urinary tract infection, and a powerful and harmful response by the body's own immune system. In severe cases, one or more organs fail. In the worst cases, blood pressure drops, the heart weakens, and the patient spirals towards septic shock. Once that happens, multiple organs, lungs, kidneys, liver, may quickly fail and the person can die. Stages and symptoms of sepsis. Sepsis, fever, increased heart and respiratory rate, probably infection. Severe sepsis, decreased urine output, change in mental status, decrease in platelet count, difficulty breathing, abdominal pain, abnormal heart pumping function. Septic shock, severe sepsis symptoms plus extremely low blood pressure that doesn't adequately respond to simple fluid replacement. Your role if signs or symptoms are noted. Medical staff should be notified immediately and documentation rules for your program followed. Be sure to report any signs of sepsis immediately to your supervisor. Preventing sepsis. The best way to prevent sepsis is early diagnosis. Treatment is most successful when treated quickly with antibiotics to fight the infection and fluids to maintain blood pressure. The most common cause of sepsis is acquired pneumonia, so seek treatment early. People at risk for sepsis include, but are not limited to, those who have weakened immune systems, children, infants, elderly. Chronic illnesses, diabetes, AIDS, cancer, kidney or liver disease. Severe burn or physical trauma resulting in damage to internal tissues, and an infection due to damage to internal tissues, invasive medical procedures, kidney infection, UTI, and pneumonia. Seizures. Seizures are defined as abnormal movements or behavior due to electrical activity in the brain. Seizures might include shaking and convulsions, and can last a few seconds or over 5 minutes. Seizures have many causes and can lead to brain damage or even death. Epilepsy is a disorder of the brain. Diagnosis occurs when a person has had 2 or more seizures. There are many types of seizures. Possible signs of a seizure include, but are not limited to, brief blackout followed by a period of confusion, changes in behavior, drooling or frothing at the mouth, eye movements, shaking of the entire body, grunting or snorting, loss of bladder or bowel control, sudden falling, teeth clenching, tasting of bitter or metallic flavor, temporary stop in breathing, uncontrollable muscle spasms with twitching and jerking limbs, and mood changes such as sudden anger, unexplainable fear, paranoia, joy, or laughter. Your role if someone has a seizure. Always follow the protocol provided by the person's healthcare provider. If there is no protocol, provide a cushion for their head and remove glasses, loosen tight clothing, turn on side, don't put anything in the person's mouth, don't hold the person down. As seizure ends, offer help. Most seizures are not medical emergencies, however call 911 if the person's protocol says to call 911. The seizure lasts longer than 5 minutes or one seizure follows another. The person does not resume normal breathing after seizure. There is no medical ID and no history of seizures. There is an injury. The person is pregnant or has diabetes. The seizure happens in water, or the person requests an ambulance. You should also immediately notify your supervisor and follow your agency's documentation rules. People at risk for seizures include, but are not limited to, those who have a history of seizures, had a head injury, had brain infections, had a stroke, had a brain tumor, Alzheimer's disease, and genetic factors.